Thank you for turning to 10, your news leader. 10 News Conference with Gene Valicenti continues right now.
Joining me in studio is the new president and CEO of Lifespan, John Fernandez. John, welcome in our first meeting.
Nice to meet you.
You're a Philadelphia guy, but you've spent time in Boston. Now you're coming to us. Has this been kind of the career chart?
Yeah, call it the I-95 chart. Yes, I'm born and raised in Philadelphia, in West Philadelphia, and moved to Boston after college and worked there at both Brigham and Women's, and then was the CEO at Mass Eye and Ear until I got the great opportunity to come here to Rhode Island.
All right. Now, you're not a medical doctor. Sometimes hospital heads are medical doctors. You have a business background?
Yes, sir.
Yeah. Now, you were up in Boston, and you mentioned those two hospitals, and then they are familiar to Rhode Islanders because a lot of Rhode Islanders run up to Boston when they get to a certain level of care. A lot of cancer treatment, heart surgeries, things like that. You're kind of on the other end of this now. What are you going to do to persuade people, don't go to Boston, stick with us, we can give you the same quality of care? That's always been a thing in Rhode Island.
We're going to recruit great doctors. What I've been telling people is we have to create a wow experience so people stay here. Yep. We have to do better access to primary care. We got to do our job, and then I think patients will stay here. I'm not too worried.
Right. Well, you mentioned primary care. That's always been a thing that the docs complain that we're not paid as well as Massachusetts. I stay in Rhode Island, I do a lot here, but I just don't get the cash from Massachusetts. What can you say about that?
We're going to have to fix that problem. I don't know how yet, but we're going to have to make it so doctors want to come here, both how they're paid, but also having the support systems they need, and as well as a great place to work, which I know we can do. I've met a lot of terrific docs and nurses, had a great warm welcome, so I'm very confident we can make that happen. We just have to work hard at it.
Been on the job about 4 months. We had a mayor of Providence who famously said, I inherited a Category 5 hurricane. What did you inherit?
I inherited an organization with a lot of great people, but we have some financial challenges that we have to meet, that all of healthcare has to meet. But just to give you a few quick statistics, Lifespan's been the most successful financially in this state. But we actually haven't been that successful. We only made $50 million over the last 10 years. To give you a benchmark for that, we should be making 2 to 3% margins so we can reinvest in our people, in our physical plant. Once you go to our physical plant, we make money to go back into taking care of people. It's not a for-profit, it's a non-for-profit. We reinvest it. So that's really important that we do that. So we should have been making 80 to 100 million a year. Instead, we only made 50 over 10 years.
Over 10 years, an average $5 million a year.
And if it weren't for the pandemic, we would have lost $30 million.
Well, we threw a lot of money into you during the pandemic. Millions and millions came into you and Care New England. Yes. It wasn't enough, or
it was enough for those. It was enough for those years. Yeah. So we did well those years, not perfect, but I would say I'd rather not have another pandemic. Yeah. Yes, we got a lot of money from the federal government, but over those 2 years, our financials were pretty good. But over 10 years, not so much.
A couple of weeks ago, I had your co-part over at Care New England, and he's new too.
Yeah, great guy.
All right. Yeah. So he's taking over, and you're taking over at Lifespan. Now, not that long ago, there was talk of your two conglomerates getting together. Well, you were bigger than he is, but your two entities getting together, and that really flopped and failed. What have you been told about that?
I've been told.
Have they been honest with the history on that? How the Attorney General slammed that and said this was bad from the get-go? What have you been told about that?
I've had many, many stories about what happened, what didn't happen. I've read all the reports. And because I was in Boston, we paid close attention to what was going on in Rhode Island. So I've got all the facts. I think that's the past. Now we just have to make our plan for the future and move ahead.
All right. Does the future include a possible merger again, trying again with Care New England? It's a small state.
I haven't quite figured out the future, but we will have a plan hopefully by September about our future. And I look at mergers and acquisitions as a tactic, not a strategy, to achieve the goals we want for our patients and for our research. And I'd also say Mike and I, and as well as the new dean at the medical school, he's the old veteran. He's been there a whole year. Yeah. Have been working a lot together, especially on research. And how do we do things together? Because the real competition is not in the state. It's in the outside world. Amazon, Uber, you name it, are after the healthcare market. So we have to think of this as bigger than just Rhode Island.
At the top of the show, we had your counterpart at Care New England. We also had the Brown University president, Christina Paxson, on. She trains the doctors. She needs hospitals as part of her education process. So before I go on to other things, is a merger still in the offing at some point, or you know what, not for a long, long time?
We have no plans for it.
You have no plans right now.
But I have no plan for our future. So will we consider it? Of course we would. But right now, that's just not what we're spending our time on. It's not worth it.
Right. Do you think Rhode Island needs as many hospitals as we have? In the overall landscape, you've got South County, there's one in Westerly, there's Kent, there's yours, and then there's 5 or 6 others from here to Boston. And then not including the regional ones over in Massachusetts. Do you think are we over capacity?
I don't know that. That's a bigger question. I haven't sized that up yet for what we need macro for the state. I think what we need for the state and this region are actually more jobs in the state. We need more, like the legislation or the budget proposal to get $45 million in for biomedical research. Great idea. That means more jobs in the state, which means a much better economy for the state, which is really what we need.
Right. That's Speaker Shekarchi's vision for part of the downtown.
Yeah, it's a fantastic idea.
Okay, so you walk into Lifespan, new set of eyes, and you see what that needs fixing immediately. You've been there 4 months. I don't know, does something strike you as I can't believe they're doing it this way, or I kind of like this?
No big surprises. I did my homework. Yeah. We have to fix our finances. Number 2, we have to create what I mentioned earlier, the wow patient experience, and creating great access. Make it easy. How can we be better than anybody else? Great access, whether it's primary care, specialties, to make it easy for our staff to take care of patients, make it easy to do the research. I see that as my job. How do we make it easier for our clinicians, our nurses, our staff to take care of patients? How do we make it easy for patients to get into our hospitals as opposed to waiting on a phone line or not being able to get an appointment? Right. Great access is really, really important.
All right, when we come back, I want to continue our conversation. We'll talk about mental health care, a backup at some of the hospitals because there's not enough beds. We'll get to all of that as 10 News Conference continues. 10 News Conference continues with John Fernandez, the new president and CEO of Lifespan. That's our biggest system. You know, we've been doing a lot about mental health. We just came out of Mental Health Awareness, and it's my understanding that because our mental health hospital, Butler, is at capacity, some kids at your hospital are not being moved quickly enough. Every bed is being taken. What do you know about that?
We have a mental health crisis, a behavioral health crisis. It's both. We have Bradley Hospital, which is a pediatric psychiatric hospital. They are very, very busy. We also have a large psychiatric service at Hasbro and at Rhode Island Hospital. It's just going to be a long, hard journey to get more providers. Use technology. I think we have an opportunity to use digital. How do we reach these people? It's a crisis across the country. We are blessed to have Butler, Bradley, and the great psychiatric service at Rhode Island Hospital.
Well, what do you owe this as a root cause? Why are we seeing so much of this now? Was it the pandemic, social media? What are the docs telling you?
I think personally, I think we're now recognizing it. We had this problem for a long time. It's just people are bringing it to life. I don't think it was just the pandemic. It probably made it worse. Access to care is terrible across the country. We are lucky to have the resources we have in New England, especially here in Providence. But it's a hard problem. I wish I had the solution. I would probably spend all my time on that if I knew what the solution was, but I don't.
Let's talk about physical plant. Hasbro Children's Hospital is the newest section of the complex over there. But there's older sections that aren't so beautiful. What's on your radar?
We have about $1.2 billion of deferred maintenance that we have to steadily fix. And you see that because we weren't making money over those years. We make money to reinvest in the physical plant, reinvest in our staff, reinvest in new programs. And so we got to get busy making sure we make our 2 or 3% margin every year so that we can fix the things that, and we are slowly but steadily fixing those deferred maintenance. And there's a lot of it at Rhode Island Hospital, but also at Miriam and some of our other health centers. So
we know Rhode Island doctors want to be paid more. They say it's not fair. You know, I throw a stone over in Swansea or Seekonk, and they're getting more money over there. And the nurses, the same thing. How do you attract and keep more nurses? Are they being paid what they're worth?
I think we're very competitive with our nursing wages, but we can always do better. We've had a lot of travelers. We've decreased that by about 25% over the last several months. So there's a lot to do and making our economics better, and then that way we can pay our doctors and keep them working here in Rhode Island. I'm confident we'll be able to get there. I would also let you know that working with the Rhode Island Foundation, the insurance companies, and all the other hospitals, have all agreed to try to figure out why there's such a difference, agree on the facts, we call it having the same set of facts, and then we can work on what the solutions are, because right now we don't even agree on the set of facts. But it's been really great to think about working together, agreeing on the facts, and then figuring out the solution of why you can go over the border and get paid 25% more.
You've already sat down with the nurses union? You must have met the people.
I've met all the unions.
Yeah. And what was the welcome ceremony? How did it
go? The first time everybody's pretty nice to you,
Yeah.
and got great advice on what could I do better.
Okay.
And one of the pieces of advice was actually the services union said, help train our supervisors better so they can be better supervisors. I thought that was fantastic.
Yeah.
So working with unions, we have them, might as well work with them.
Now, you told us a little earlier you only made $5 million on average a year. Not you personally. This is the whole system.
Yeah.
Right. And you've got to triple that to keep in business. A lot of that has to do with losses for uncompensated care. A lot of people come into the hospital, emergency room, they use it, they don't belong there. Number one, how serious an issue is that? Uncompensated care. You're not being paid.
I'd say the bigger issue in this state, because a third of the population's on Medicaid, and so we need to either get more people employed, new jobs like I talked about earlier in the state, or how do we deal with the Medicaid reimbursement so that those patients that come in on Medicaid, we can get paid better so we can make some money.
Was that a stunning statistic when you saw that 1/3 of Rhode Island is on Medicaid? 1/3 is another statistic. 1/3 of Rhode Island is also on some form of social assistance, be it the SNAP benefits or whatever, you name it. 1/3 of Rhode Island, we're 1 million people. That's a sobering statistic, isn't it?
Yes, it is.
And
it wasn't a surprise when I got here in February, because I studied up in October and November when I was looking at the job. It's one of our challenges. That's why I think it's really important we work with the mayors, the governors, the business leaders. How do we create more jobs? Because nobody wants to be on Medicaid or public assistance. We need to help them. We need to make sure that there's jobs in the state.
creature comforts. How's your food?
Food's been incredible. I keep trying a new restaurant every week.
Yeah.
I do not have a favorite yet, though.
Right. How about within the hospital? What are you hearing? Complaints about the food you serve your patients? What are you hearing? You have enough coffee shops? What are you hearing?
I have not heard complaints about the food. I eat the food, so it's pretty good. It's still hospital food. Let's be realistic.
That's true. Yeah, I guess the applesauce is applesauce.
You should see. I went down to do a tour of the facility. I mean, they are cooking for a lot of people at our facilities. So it's hard to make really perfect food, but it's pretty good.
Right. And parking and things like that. These are things that come in, peripheral complaints for a hospital administrator. Yeah. Valet in some spots, right?
Yes.
Yeah. You're going to continue with that?
Yes. We want to make parking even easier. There's a lot of surface parking lots around the city and also in the other places, but we want to make it, that's when I talk about how do we make it easier for patients? Mm-hmm. All those little things add up. How do we make it easier for our staff? How do we make it easier for our patients is really what we have to focus on every day. And hiring kind people and being kind to our patients and kind to each other is what I'm going to be all about.
You're talking about bedside manner?
From bedside manner to when you walk in the front door, the valet, every step of that way. If we can encourage people to be kind to one another and then kind to our patients, I think we'll be better off.
All right, so the headline is you've been there 4 months.
Yep.
You got a lot of work ahead.
Yes, sir.
You're not sure about a merger? Talk to me months and months from now, and we'll see.
Yes.
All right, thanks for coming in. John Fernandez, he's running Lifespan, been there for 4 months, and that's the very latest from him. We'll have you back again.
Great. Sounds good.